A viewer recently asked me to do a video about the SILS sleeve. SILS stands for Single-Incision Laparoscopic Surgery Sleeve Gastrectomy. Some people who have heard of this surgery wonder, is a single incision better than the normal several small incisions? Great question, because on the surface it sounds very appealing. One incision instead of 4 or 5, less scarring, maybe faster recovery? Sounds like an easy win, right? But as with most things in surgery, the answer is a little more nuanced. Hello, I'm Grace, and I'm a physician assistant with 20 years of working with bariatric surgery patients. With a traditional sleeve gastrectomy surgery, the surgeon usually makes several small incisions across the abdomen. These are often very small, usually about ½ inch or so. The one exception is the incision where the removed part of the stomach comes out. That incision is a little larger, usually closer to about 1 inch. And in some cases, depending on the surgeon's technique and the patient's anatomy, that larger incision may be placed near or hidden around or inside of the belly button. With the SILS sleeve, the goal is to do most, if not all, of the surgery through that single incision around the belly button. So the cosmetic appeal is obvious. Instead of several tiny scars, the patient may just have one scar that is partially hidden in the natural shape of the belly button. But here's the important part. One incision doesn't automatically mean low risk. The main potential benefit of a single incision laparoscopic sleeve is usually cosmetic. For some patients, having fewer visible scars matters a lot, and there are surgeons who are very experienced with the surgery and have great outcomes. I actually polled a group of bariatric surgeons to get their real-world experience and opinion on this technique. One surgeon reported doing hundreds of single incision laparoscopic sleeves since around 2010 with good recovery, strong cosmetic results, and operative times similar to their multi-incision approach. So yes, in the right hands with the right patient, it can be done successfully. But that was not the only opinion I received. Other bariatric professionals were more cautious. They raised concerns like longer case time, more difficult instrument movement, less ideal visualization, and potentially a higher risk of an incisional hernia since that one incision is larger. And this is where I think patients really need to slow down and think about the trade-off. Because during a sleeve gastrectomy, the surgeon needs to perform the surgery with excellent visualization and precision, and they need to be able to manage the staple line carefully. So if a technique makes the operation more awkward or limits visualization, the cosmetic benefit has to be weighed against that, because the goal is not just fewer scars. The goal is a safe operation. And this is also important. The standard laparoscopic sleeve incisions are already quite small, and after healing, most patients find that they're barely noticeable. So if a patient is mainly worried about scarring, they may not need a single incision surgery to get a good cosmetic result. So if this is a concern for you, you can ask your surgeon, where do you usually place your surgical incisions for the sleeve gastrectomy? Can the extraction incision be hidden near or inside the belly button? Normally, how visible are the scars after healing? And do you offer smaller port or reduced port approaches, meaning a smaller number of surgical incisions or ports placed to perform the surgery? Now let's talk about the belly button itself. Using the belly button can help to hide the scar, but the belly button is also a deep skin fold, so it can be harder to keep clean. So umbilical incisions may add some added wound healing or infection considerations, especially in patients who have deeper belly buttons, deep skin folds, diabetes, smoking history, prior infection issues, and other wound healing concerns. This does not mean that the single incision laparoscopic approach is bad. It means patients should ask their surgeons about their personal risk and whether that approach makes sense for their anatomy. So what's my practical take? If you're considering sleeve gastrectomy and you hear about the SILS sleeve gastrectomy approach and you're interested if it'll work for you, don't just ask, will I have fewer scars? Consider the questions and issues we discussed today. And then, very important question, could the standard laparoscopic approach give me an acceptable cosmetic result? For most patients, the safer surgery is worth the minimal scarring. Remember, this is not personalized medical advice. I recommend having an honest, open discussion with your bariatric surgeon who can help you choose the surgery and approach that will provide the best outcome for you. And if you're trying to understand the difference between the weight loss options out there and what life after surgery actually feels like, that's exactly what we discuss on this channel. So subscribe. I release 3 videos a week that help you understand all of the options available in the professional weight loss world. Thanks for watching, and I'll see you in the next video.